A lot of the horses we work on are a little older, you know, say 8 to 12, 13, 14, 15 years old. And a lot of them are metabolic, and a lot of them are on a lot of medications, maybe some steroids for, you know, maybe performance enhancement or maybe for other issues. And a lot of them start having laminitis problems before anybody ever realizes it. And that's why, me personally, I like to radiograph my horses at least twice a year. And if there's issues with them, even more than that, to monitor the sole depth, inflammation of the lamini and things like that. We see a lot of cases. So I work for 3 clinics here as far as doing specialty podiatry work. And some of the horses will come in and they'll present just with a foot soreness on one side, or maybe they get blocked and they're diagnosed with a heel pain, something like that. You go in and investigate a little bit further and you find out these horses have the beginning stages of laminitis. Maybe no rotation, maybe not even a digital palpable pulse, but they do show lamina swelling on a really good digital radiograph. And the people that are experienced with that can hit a lot of problems off quick. There is a lot of misdiagnosis with that, either being the farrier, not seeing it, and maybe a little stretched lamina. You know, when we're shoeing these horses, you get to know them, something looks a little abnormal, and we hoof test all our horses when we're shoeing them. And something that I do is I train my grooms to check the pulses every day when they're temping these horses and kind of find out what the normal is on them. And also we use on some of these horses, I'll use a lot of times horses I think are a little bit suspect. We'll start monitoring them with a laser thermometer, you know, the ones you use in the automotive industry. And it's pretty amazing how those horses' feet, one side or the other, will heat up, you know, like after work. A lot of them are like 85 to 90 norm, and they go out and start working and one foot might heat up a lot more than the other. And that's some of the stuff that we do in our practice. We're a little different, that we have the kind of clients that can afford to have people pay a little bit more attention, you know.